Are you dealing with the aftermath of a traumatic brain injury or a concussion and still noticing that you have brain fog? Well, it may not all be in your head. There are significant GI symptoms that happen after that big blow to your head. Hi, I'm Dr. Wanda Bettinghouse, functional medicine doctor. Many people who have suffered from a concussion will continue to have symptoms after that event. Of course, one of the big symptoms is brain fog, the inability to concentrate and focus. There also may be memory loss and an inability to really concentrate after that significant blow to the head. But then the question comes up, what about the gut? Yes, TBI, or traumatic brain injury, can cause gastrointestinal disturbances. It can cause a decrease in the motility of the GI tract, a decrease in the release of gastric enzymes that help digest food, and also an impairment in the immune system. If you have had a concussion, you're going to need a careful examination of your brain function. And of course, that doesn't often happen in traditional medicine. In addition to understanding distunement in the function of the brain, also we need to look at the GI function. Now, from a functional medicine perspective, we need to assess all the organ systems because that's what sets functional medicine apart from traditional approach. So not only do you need to have your brain function assessed with doing a EEG, also called an electroencephalogram, but also a careful evaluation of your GI function, your digestive system. Now, with brain injury comes inflammation. The brain gets inflamed, and that inflammation can spread throughout the body. And you may then start experiencing inflammation in the GI tract so that you can't digest your food properly. And with that improper digestion of foods come the potential for nutrient deficiencies. And that's what we do in functional medicine. At our clinic here at Healing Unleashed, we do a EEG on people who come in with symptoms of brain fog, even though they may not remember that traumatic brain injury that they had sometimes even years ago. So one of the first things that I do with most of my patients, but especially somebody with a history of concussion, traumatic brain injury, is to do a careful analysis of the GI system by doing appropriate functional medicine type tests where a stool specimen is analyzed for inflammation, the microbiome, and other aspects of healthy GI function. Now, to go deeper on this topic of brain injuries and GI disturbances and other GI problems, you're going to want to register for my free mini course on the importance of gut health. And you do that by simply clicking on the link below this video.